I'd like to call the Wednesday, December 2nd, 2020 Papillion City Council meeting to order. Ms. Brown, would you please take the roll?
Sunday, Mumgard, Gaines,
Here.
Glover, Jaworski, Klug, Stube, Ingberg.
Would you please join me in the Pledge of Allegiance? Thank you. And do we have an affidavit of publication on file?
We do.
And a current copy of the Open Meetings Act is posted in the back of the council chambers. Do we have a motion to approve the consent agenda? Motion by Councilman Ingberg, second by Councilman Jaworski. Do we have any proponents or opponents? Any council discussion? Please vote.
Gaines votes yes.
8 yeas, 0 nays.
Motion passes. Next is why we're all here. I want to give some opening statements, so kind of some ground rules and context before we open the public hearing on the ordinance. So an ordinance takes 3 readings, and according to state law, the readings are on 3 different days. And what the readings are, the first one, it's just an introduction. A council member says, we'll introduce this, no other action that night. The second reading, which is tonight, is the public hearing, the public's chance to speak on that topic. And then the third reading, the next night or the next meeting, is where the council discusses and votes. And so that's the normal procedure. And that's how we published it. Council has a right to change that rule during a meeting. And so last night at the introduction, there were a number of people here. And so realizing they were here, there was a motion to open up the public hearing yesterday. So there was I think about 20 people yesterday that spoke. So we've basically already started the public hearing, and then tonight we'll continue it. And that's all that information's on the record. I mentioned that since it in effect is still just one public hearing, our ordinance or our bylaws, our rules basically say each person gets 1 chance to speak. So if somebody was here last night and spoke, that is still part of this public hearing. We carry that onto the record. You don't come up again tonight and speak a second time on the topic. So we appreciate that. And then the other thing is council can waive the third reading. And what that would imply, and I don't know if they'll do it or not, but it'll come up in discussion after the public hearing. What that would imply then, if they waive the third reading, it would in effect say they don't want to have tomorrow night's meeting, let's just handle it tonight. And to do that, that takes a super majority of the council, so 6 of the 8 would have to vote on that. So there is a small chance we'll have council discussion and vote tonight, but we won't know that until we get to that point. So that's kind of the ground rules. Because of social distancing and the room's kind of small, not everybody's in here. We're using all 3 floors of City Hall. The old council chambers on first floor, people are in there, and we actually have the TV and sound set up so people can see what we're doing. And we also have a break room on 2nd floor, and we have another room on 3rd floor. So people that aren't in here are still seeing what's going on. The only other thing I'd say is if you're in the chambers and you've spoken, and if you don't want to stay after you speak, that'd be a good time to go ahead and leave, because that'll open up a seat in the chambers for somebody else to come in. I'm not going to force people to leave, but out of courtesy, it might be a nice thing to do. So that's enough of the opening. Item C1, Ordinance 1911, an ordinance to amend Papillion Municipal Code, Chapter 125, entitled Health and Sanitation, to add new sections 125.11 through 125.23 to enact requirements for the wearing of facial coverings under certain circumstances so as to abate the COVID-19 pandemic and to provide for an effective date. This is a public hearing, and at least for the ones in the room, I will start with proponents. Anybody that wants to speak in favor, and we will run a strict 5-minute time speaking. I'll give about a 2-minute, a 1-minute, and a 30-second warning most of the times. And we would ask you to wrap up at 5 minutes. Anybody want to speak in favor? And I'll ask anybody that comes up to state your name and your address for the record. Go ahead and come on up. Welcome.
My name is Brett Brassfield. I'm at 8010 Azul Circle, Papillion, Nebraska. Mayor Black, members of the City Council. For those of you that don't know, again, my name is Brett Brassfield. I am the Board of Education President for Papillion La Vista Community Schools. We're aware that the City Council is considering a mask mandate for its citizens here in Papillion. Papillion La Vista Community Schools, as you know, has some experience with this requirement. Currently, our students are in school after Thanksgiving break. What I wanted to do this evening was give you some context and some understanding of what we went through as part of that decision process, so that you had an understanding of what that experience was like, what we're still going through, and some of those kind of things. We thought that that might help you make your decisions. If at any time you have a question, please feel free to ask. One of the key components to returning to school on August 11th of this year was implementing processes, policies, and procedures that will help our students return to school successfully. A key component of that process was masks, along with hand washing, social distancing, and other cleaning procedures during and after the school day. This decision was not based on just our opinions. We worked closely with the CDC and the Sarpy County Health Department. We surveyed our staff. We also worked closely, of course, with the Board of Education to review this. We wanted our students in school. That was the goal. The student body and our staff represent a significant component of our citizens. Just so you know, for some context, there are approximately 13,000 students, staff, teachers, and support staff in our schools each day. The masks were very important to making sure that that was successful. While we do have some folks that do not wear masks for medical reasons, and then also the district has provided alternate education options for these students to take school from home, to accommodate their families, whether that be personal reasons or whether that be health reasons. I wanted to share with you some general observations. Basically we're coming up in December, so now we are 4 months into this return to school. Mask compliance has been extremely high for our staff and very effective at all the buildings. While there are always some incidents here and there, generally speaking, it has not been much of a challenge. The compliance has been very high for our students. In fact, I would say that we are quite impressed with our students' behavior around this. Many students even choose to wear masks when not required. We do have procedural mask breaks that they can take, whether that be on the playground or out on the sidewalk or public areas when they can space out, and the students choose to wear them because they choose to feel safe.
2 minutes.
There have been positive side effects for wearing masks as well. One of the positive side effects is behaviors. People feel more comfortable with this, and with this policy and procedure in place, it allows the teachers to teach. It allows them to conduct their business in their classroom without having to negotiate with the students about what's best for them around the masks. Parents have overwhelmingly supported this, while not unanimously, and we understand that. We understand our parents' concerns. The students, though, and those families chose to return to school. 90% to wear masks or refuse to have them wear masks. We understand that. There are concerns around those things, but overwhelmingly the board supports the masks. And recently there have been concerns shared by the PLEA, which is the Education Association, about these concerns because they feel they're caught in the spot between the community and the schools, and they want to help prevent community spread. As a parent and a citizen, I thank you for your time this evening. I thank you for your support for our community. And if at any time you have any questions, please feel free to reach out to me. I'm always available as board president. Thank you.
Doctor, I have a question. What is your reaction to Dr. Fauci's comments yesterday where he admitted that children are not generally super spreaders and that they are definitely not at high risk for this particular disease?
I appreciate Dr. Fauci's service to our country. He has done an excellent job. And while they are not considered super spreaders, I understand that, but they can be asymptomatic. they can be carriers of this. And frankly speaking, they have done a good, because of the procedures we put in place, our rate of transmission has been very low. And that's based on the procedures we put in place. The concerns we have at the school are the folks that surround those people that test positive in the community. That impacts quite a few kids, whether they be 10 to 15 to 20 kids.
Mr. Mumgarde.
Our ordinance has an exception for children under age 5. Now, this might be beyond what you've talked about. Did the school board consider at all an appropriate age limit? Can you give us some guidance? Should we use 5, 10? What should be the?
We relied heavily on the CDC and in particular Sarpy County Health Department for guidance around this. While we do have programs for students that are under the age of 5, many of those services are administered in the home. And we do have those options there where they can feel comfortable with that piece. But the general guidance was that all students should be wearing masks when they are in school. And generally speaking, most kids are 5 at the low end. When they enroll, they have to be 6 by a certain day.
Mr. Glover.
Yeah, Mr. Brasfield, do you have any statistics on whether you've had any students that have gone to school, elementary school students that have gone to school that have COVID? Or
I do not, Mr. Glover, I do not have those statistics with me this evening. Those can be readily available if you want to contact Annette Iman. She is, she manages our contact tracing. And, she has information that she reports to the Sarpy County Health Department about how many students are positive, and then how many students are quarantined with regards to those positivity. I do know that the ones that generally are quarantined, many of these students are not getting those positive results or getting transmitted within the school bounds. A lot of that's happening in the community outside for extracurricular activities. They're not under the purview of the school.
Mr. Sunday.
One of the speakers last night raised what I thought was a valid point. Children learn by observing other people's facial expressions. They learn empathy. They learn to read emotion. They learn human interaction skills. And we're taking that away from them. Do you have any concerns about that long term?
We did have concerns about that. We have helped provide access to masks that do have some of the clear shields, in particular for some of our students who have hearing impairments. They can better see their mouths and those kind of things. I truly believe education is a foundation for anything and everything that we do in the society. Educating our folks and voting. These are two key components to our society. And while I do understand, Steve, your concern with the piece that they're going to maybe lose with this, I think not having them in school and some of the mental health concerns around not being with others. And this was one of my criteria for implementing masks. And secondly, food insecurity. 1 in 5 of our children has some sort of food insecurity. And we provided roughly 2,500 students meals during COVID shutdown in the spring. And in the off periods through the summer, they did not have access to those meals because they could attend school. So those were 2 primary concerns for me, Mr. Sunday.
Thank you very much.
Thank you.
One other procedural note for folks, I do hold very strict to the five minutes, and you'll notice that. But if a council member asks a question, that is their right to do it, and that does not count against time. So sometimes you'll see somebody up a bit longer, but it's because a council member asked a question. Thank you.
Thank you, Mayor Black. Feel free to comment back with questions. I will leave and open my seat up for someone else who wants to speak.
Thank you. Do we have any other proponents? Anybody want to speak in favor? Just go ahead and come on up. Again, if you'd state your name and address for the record.
Hello, my name is David Quimby. I'm on 913 Winwood Lane. I'm an infectious diseases doc with Creighton University and CHI Health. And I've been to a few of these type of meetings before, and there's always the same points made over and over. So instead of just doing a general spiel, I will bring these up because they always tend to come up. One that always tends to come up is, you know, COVID mortality is not that bad and it's overblown. Look at the death rate. Okay, if you go to the state of Nebraska dashboard with the data that is there and break down the demographics, people who are 55 to 64 have a 0.7% mortality. That's not people who are in the hospital that die, that's all comers who get infected. 65 to 74, it's up to 2%. 75 to 84, 6.5%. Those over 85, 11.4%. So anyone who tries to say, you know, the mortality is not that bad, is basically saying people over 55 don't count because they're old and they're going to die of something anyway. And yet we spend money on cancer research and heart disease treatment. One issue that tends to come up is about carbon dioxide retention or oxygen deprivation. I really don't know what else to say about this. You can easily find videos of people running on a treadmill with a mask, fine oxygen levels. You will find somebody that says, I put a CO2 monitor under my mask and look, it's reading elevated. Yes, that's your exhaled breath. If you put it there without a mask, it'll be elevated as well. People around the world are managing to wear masks without keeling over of carbon dioxide narcosis. People in the hospital wear them all day long. We're not falling over. Surgeons have been wearing them for hours at a time for years during surgeries, and they're not all falling over. The issue of personal liberty and forced compliance with the state tends to come up, and it hurts me to say this, but I even heard somebody say at one meeting, first they make you wear a mask, then you're wearing a yellow star or an armband, comparing it to Jewish people in Nazi Germany. I hope that nobody here would feel that way. I would point out though, that there are already lots of things that the state or municipalities do to impact our personal liberties. A simple, obvious thing like crossing the street. We have crosswalks. We have rules against jaywalking. That is infringing on, I want to cross the street right here to protect my personal health. On a more health front, there's things like motorcycle helmet laws, no smoking in restaurants, things like that. That is clearly impacting someone's personal liberty if they wish to smoke in public, and they're not allowed to. The public health is felt to triumph their personal rights. There's the whole, well, you know, masks don't work argument.
2 minutes.
Someone says a virus particle is 100 nanometers that'll fly right through. True, but it's attached to the water droplet, which does not. It does catch a lot of the droplets. Various animal studies between cages and airflow shows it'll work. There was recent data out of Kansas with countywide accepting mandates or not, where the counties could opt out. In the 24 counties who stayed in before mandate, they had 17 per 100,000 cases per day. And a month and a half later, their rate of infection was 16 per 100,000. So pretty stable. The counties that opted out started with a rate of 6 per 100,000. And at the end, they doubled to 12 out of 100,000. So no, it's not perfect, but it does help. It kept things stable and did not make it worse.
1 minute.
Thank you. Are they perfect? Cure-all? No, but they help. And there's no medical drawback. The only really significant drawback is someone stating their personal discomfort is more important than a public good. There's always somebody saying there are certain medical conditions which preclude wearing a mask, which is true, which is why pretty much every mandate has exclusions built in. Thank you.
Thank you.
I have a question for Dr. Quimby.
Go ahead.
I've been looking at some major causes of death here in the United States. In 2018, there were 67,000 plus opioid overdose deaths. There were 95,000 deaths attributed to excessive alcohol use. There were 22,000 deaths from the flu. Dietary risks, according to the Center for Science and Public Interest, accounts for over 500,000 deaths in the US per year. Tobacco use, almost 500,000 deaths per year. Low physical activity, nearly 100,000 deaths per year. And auto accidents, 38,000 deaths per year. These are all risk factors. Are you suggesting that we should outlaw and curtail all these things as well?
Well, We have seatbelt laws to help with the car deaths. We have age restriction laws for tobacco and alcohol deaths. So society is doing some things for that.
Thank you.
Thank you.
Do you have any other proponents? Anybody want to speak in favor? And just go ahead and come on up.
Good evening. Sorry. My name is Austin Blankman, 5207 Timber Ridge Drive, Papillion, 68133. I was born and raised in Papillion. How we met a year ago, I would have told you that I'm a NICU nurse caring for critically ill infants in the ICU. Today, I stand before you as a COVID nurse caring for the most critically ill among us. I have served in New York City for the Iowa Department of Homeland Security and for the Florida Department of Public Health. On April 7th, I left my family, friends, job, home, and everything that I had ever known. I bought a one-way plane ticket to New York City. I wanted to do what I could help. Many of you, like myself, turned on the nightly news in the comfort of our living rooms. We saw the horrors, the carnage and death, crippling a city harder than many of us remember in 2001. I could not stay home and do nothing. We'd awaken at 5 a.m., donning damp, soiled scrub, washed our hands in sinks from the night before, and we'd stand in the mirror and take a breath for our patients who no longer could. We'd look at our exhausted reflections. Our reddened, blistering faces looked back at us. We'd hold back the tears, no time to think about ourselves, process what we saw the night before, no time to tend to our emotions. It was there that I worked 15-hour days every day for 7 days a week for 53 days. Although a nurse for only 4 months, I was appointed to oversee the unit in which I oversaw 42 COVID positive patients. And what was it like, you might ask? It was horrible. It was heartbreaking. As I walked down the narrow hallways of the old hospital, I couldn't help but notice empty beds and empty rooms. Days prior, patients laughed, shared stories, and spoke to their family on the phone. Soon after, they lay lifeless in a black body bag stacked in refrigerated semis behind our facilities. With each passing day, another heart would stop, a final breath was taken, and another patient of mine fell victim to COVID-19. I'm not an emotional person. This journey the past 9 months has changed that. Typically, I can tolerate death. I've had babies die in my hands while trying to resuscitate them. I've seen infants removed from life support. I've comforted the families following. This does not compare. Helplessly watching someone gasp for air like a fish thrown upon the shore is never a sight I would want to see, but it's one that I will never be able to unsee. Hearing the voice of a child bargain with God not to take their daddy is something I never can unhear. The unconsolable sobbing of a patient's wife of 65 years saying goodbye to her husband through a phone is something I will never forget. Knowing that I, an unrecognizable stranger in PPE, is the last face my patient will see breaks my heart, but this is our reality behind hospital walls. Nursing for many of us has truly been the most non-rewarding job the past 8 months. Most of our patients die. Our cries have gone unheard. Our efforts have been met with resistance. We've been told our personal experiences are not real. We can't touch our faces to wipe the tears behind our face shields. We sniffle behind our N95 masks, but we can't take them off because it's not safe, nor is it time. Although terrified, we sing to our patients and hold their hands so they don't have to leave this world alone. We have to tell people who took COVID seriously, wore their masks, social distance, and did everything right, that they will not be able to see their family again because the man at the grocery store behind them who refused to wear one got them sick. We've had nurses on our floor die after contracting the virus while caring for the sick. Our faces have been spit in.
2 minutes.
For many, the pandemic ended when lockdowns lifted, people flooded the bars, hosted or attended parties, and became lax. Now here we are. While those had their fun and turned their backs on reality, we were in hospital picking up the slack for many. We were the ones who were paying the price for the decisions that they decided to make. Although the pandemic ended for some, it has never ended for us. And now, when the country needs us most, so many of us are exhausted. We're tired. The implementation of mask mandates, as you will vote on tonight, are rooted in concrete evidence that masks do work. I'm so proud of all of you for considering this crucial decision that will safeguard our communities. This implication will save lives. I open up the floor to any questions.
Thank you. Mr. Ingberg.
Yes, thanks, Mr. Blackwood, for being here. I was wondering if I could ask a couple of questions, if you don't mind. The first one I'm curious about because of your intimate interaction with COVID that probably no one in the room has had. What would you like to say to those who aren't working alongside you and your colleagues in the hospital?
Well, tonight, I think that we need to understand that the decision you make will be met with criticism by many. However, a mask mandate, if it is implemented, will be supported by a majority of our community and a majority of people who cannot be here today because they fear coming here and contracting a virus. Sorry. Although some may voice that COVID is a hoax or that nobody wishes this virus, I can tell you that nobody wishes this virus is a hoax more than the healthcare workers that I work with, the victims who have died from it, and all the other people who are at home in our communities because the odds of surviving are stacked against them. The argument that 99% of people who contract the virus is fine is not rooted in fact. However, it minimizes the death of 270,000 Americans and will only contribute to our hospitals running out of beds. So to them, I say that when our hospitals do run out of beds, who's going to be there to care for you? If we have no more room, we will have to turn patients away, and we don't want to have to do that. We don't want people dying in our parking lots.
Thank you. Mr. Ingberg.
Yes, the second question I have is, what would you say to those that oppose the mandate and who perhaps might say that there's no benefit if we enact this mask mandate? What would you say to those folks?
To those people, I would say that I hope that you do hear us. I hope that you don't forget about the exhausted nurses who cry themselves to sleep every night. I hope that you don't care or forget about us who hold the hands of someone's father, mother, grandparent, or child as they suffocate to death. Us who sit at the bedside, cry with our patients on FaceTime as they say their final goodbyes. Us who load the bodies into refrigerated semis, and my colleagues who had to pour ice on those bodies in patient bathrooms to keep them from rotting after the refrigerated semis could no longer keep up. I don't want anybody to have to see the severity of the impacts that I saw when I was in New York City. That's why I've come here today. I hope that upon making your guys' decision, you don't forget about us. And to those who have always heeded our calls, I do want to thank you. To those of you who are skeptical in the crowd, please know that we do hear your concerns. We understand that you haven't been personally affected. We hear your calls for freedom, but we just ask you to see us, to hear us. Although many of you may see us as the enemy, please know that we are not. We are your friends, your neighbors, and we are trying to keep our country from crumbling. And I hope you find it in yourselves to see that.
Anything else, Mr. Ingberg?
Well, I understood from that you are currently in Des Moines. Is that correct?
Yeah.
You're okay. But you spent your time in New York City and Florida in the hot spots. What brought you here? Did you travel from Des Moines all the way here just to testify?
I did. So I'm actually a part of a deployment of 150 nurses that are deploying within the state of Iowa to go to hospitals across the state this week. I actually just went to Des Moines the other day, and unfortunately now here I am again. So I just drove the 5 hours round trip to be here to speak with you guys all today.
Well, thank you. I appreciate you taking the time. Thank you.
Thank you.
Thanks.
Any other council questions? Thank you very much.
Just
Any
so-
other? Oh, I'm sorry.
I'll
Mr.
just-
Mumgarden.
Okay, what school did you go to?
Papillion South.
And then where did you continue your education?
I continued my education actually in Des Moines, Iowa. So I went to Mercy College of Health Sciences.
Are your folks still here?
Yeah, my parents are still here. And then my grandma, I think you actually live beside her in Buccaneer Bay. So
I do. Thank you.
thank you. Thank you.
Thank you. Any other proponents want to speak in favor? If there are, just go ahead and come on up. See none? Any opponent? Okay, go ahead. We got a lot of people, so as soon as one's done, if the next one wants to come up, that'll help a lot. If you'd state your name for the record.
Jared Wagonish. I live at 347 North 41st Street, Omaha, 68131. I'm an educator here in our community. I am not here speaking on behalf of the school district tonight, but you have already heard from them in support of this measure, and we appreciate that. I am the vice president of the Papillion La Vista Education Association, so I am here tonight speaking on behalf of our PLEA board, who represents 620 certified staff members in the Papillion La Vista School District. Educators are working tirelessly to keep students safe and the school year running smoothly. The most difficult part of this work has been ensuring every single day that our students are masked, that they're washing their hands regularly, and that they're staying distanced. But as you heard, we're doing that work and it's going pretty well. But quite frankly, it is daunting to realize that despite all that work that we do every day, these students that we work with will leave and go to public places in the community that are not using the same protocols that we are getting them to follow and working so hard on every single day. And then they're going to come back and enter our classrooms the very next morning. Our schools are only as safe as the conditions in our community. And we as educators are also concerned for the many students that we have who cannot attend school in person because they live with someone who has a high-risk condition, or maybe they even have a high-risk condition themselves. So right now, remote learning is the best option that we can offer them, and we're trying hard to make this work. But we know that this isn't the learning environment that they deserve, and it's certainly not what they would have chosen at the beginning of the year. Our most vulnerable students and community members deserve a community that is willing to act by asking people in the community to take simple measures, put on a mask, to protect these vulnerable students and community members' safety and well-being. The rise in cases that have been identified and students who are quarantined over the last month makes it clear that we cannot continue to maintain a high quality teaching and learning environment without the help of the rest of the community. And that is the opportunity that you all have tonight, is to offer us that help. We urge you to please pass this measure that your public servants are begging you to pass. The school district, the teachers, the doctors, your community health board, your city physician, your police chief, your fire chief. All of our public services are being stretched to the brink, and we are asking you to offer this help that our most vulnerable students and community members deserve. Thank you.
Thank you. Next proponent.
Good evening, everyone. Brandon Grimm, 2411 Sand Hills Drive here in Papillion. I'm the Associate Dean of Public Health Practice at the University of Nebraska Medical Center College of Public Health. I'm a social behavioral scientist. I'm also on the board of health at Sarpy-Cass Health Departments. And I'm not going to repeat a lot of what you've already heard. I know in your packets you've seen the data from my colleagues at the Global Health Center on the benefits of masks and mask mandates. And if you have questions about that, I'm happy to answer some of those if you have questions about that packet. But what I want to talk a little bit about is the benefit of mask mandates to behavior change. In public health, as behavioral health scientists, we've been doing policy change for decades to try to encourage healthy behaviors. As the doctor or the physician said before, we have seatbelt laws, we have helmet laws, we have sugar sweetened beverage laws, we have taxes on tobacco so youth don't start smoking. This is very similar to why we're encouraging a mask mandate as well, to change behaviors of our communities. It's not about trying to tell someone what to do. It's about changing behaviors, because if behavior change was easy, we'd all exercise, we'd all be healthy, we'd eat healthy, we wouldn't smoke, we wouldn't drink excessively. So we put these measures in place to help with behavior change. And no time better than now to do that, because as you heard, our healthcare facilities are overrun. Our public health practitioners are stressed. And right now they should be thinking about how they're going to mass vaccinate a population, not worrying about contact tracing, 100 individuals every day, not worrying about treating patients at 75% bed capacity. They should be thinking about how they're going to vaccinate and get our communities healthy. So I believe if you pass this, we will save lives, we will slow the spread of COVID in this community, and we'll have better health outcomes for Papillion residents. Thank you.
Thank you.
I have a question for the
Mr.
doctor.
Sunday, go ahead.
Doctor, I'm going to hold up two graphs for you.
Sure.
These were taken off the dashboards of Douglas County and Sarpy County yesterday. These two graphs represent new positive COVID testing on a weekly basis in each of the counties.
Sure.
And I think we can agree that the graphs are almost identical. And yet one of the counties, the largest city in that county, Omaha, has a mask mandate, whereas in Sarpy and Cass counties, it's on a voluntary basis. And yet the results are virtually the same. I think we can agree. So why is it necessary to force people with a mandate when most of the people are adhering to it voluntarily when they go out into the stores?
I think the reason is, if you think about when I talked about the seatbelt policy, people were wearing seatbelts. We didn't have a policy in the state of Nebraska until 1983, and people wore seatbelts. But when we passed the law, we saw a significant increase in seatbelt use because there was a policy. So it's not about enforcing policies and mandating things. It's about trying to change the behavior. We know people will follow policies if we change the behavior. In your graphs, so Lincoln, City of Lincoln, and Omaha. Yeah, exactly. The health departments. So the per capita infection rates at both those big cities, if they were at the same level as some of our smaller communities, our healthcare system would already be overwhelmed. So they have leveled out. Yes, they're still going up, but without a mask policy, we believe that it would be going up even higher.
That answer your question? Okay, Mr. Mumgard.
Okay, those two graphs, I looked at them, and yeah, they have Douglas County and then they have Sarpy County. Well, my experience in living in this area, that county line is imaginary. People go back and forth all the time. So I wondered, what good is it in comparing Douglas and Sarpy when we have that intermixing that goes on constantly? Do you have thoughts on that?
So what benefit comparing them?
Well, I'm looking at the Omaha mask mandate and at that chart, and I'm thinking, well, unless everybody that's really getting mixed into Omaha is following the same rules, those graphs don't mean anything.
I tend to agree with you. I think we need a citywide, metro-wide mask policy, and we're getting close to that. If Papillion passes, we will have close to that. We'll have Gretna, we'll have Papillion, we'll have La Vista, we have Omaha. So we'll get close to that. So crossing city lines will have a better benefit. If Papillion, our next largest metro area in the metro, passes that, it won't matter if we're crossing lines. And right now, I agree with you. Yes, I work in Omaha at the Med Center, but I live here. So yes, we have all kinds of people crossing lines all the time. So I think the benefit is having more communities passing mask mandates. And that's why we've seen some of the other data of masking policies is when full communities, full cities pass them together in all the metro areas, we'll see a decrease because everyone is wearing a mask.
Would that benefit then be increased if, assuming the mandates work, if those mandates went beyond the city limits? We're talking about a mandate that covers 6.5 square miles.
Yeah, I understand.
And we got a good portion of the population of Sarpy County lives outside of these restrictions. Would that benefit then be increased if it went to a county-wide, statewide, area-wide, anything like that?
Well, the benefit would always increase if we would have had a statewide mandate, of course. Yeah, that would be the best benefit of all, a statewide mandate. And I think in your package, you saw a survey that actually I did of the state of Nebraska, where we had over 8,000 respondents, and 85% of the respondents agreed and supported a mask mandate of those 8,000. Here in Sarpy County, there was over 700 respondents, and 85% supported a mask mandate as well. So I think there's support there. And yes, having larger populations covered by a mask mandate is always going to be better.
Thank you.
Mr. Ingberg.
Doctor, I don't mean to be simplistic about this, but to me, when we talk about those graphs comparing counties, to me, it seems really difficult and not realistic to really compare both counties for a couple of simple reasons. There's too many variables between the counties. For example, people like to compare graphs between this area and Omaha, this area and Lincoln. Well, Lincoln, you have a university population that tends to group in large groups in bars, taverns, whatever, that we don't have. Omaha, I think most people would agree, that a real high-risk population that they have, that we don't have, are living in poverty or lower income situations, and they're a higher at-risk population to begin with. To me, don't you think that influences what the graphs depict rather than just, don't they look similar?
Sure. So your rates are going to be different based on the population that you have and the and the individuals that are in the population. Absolutely. So having a university system, yes, that's going to change because you have more younger kids living in the population. I would argue the same argument that people can cross the line. Just because I go to school at UNMC or UNO doesn't mean I actually live in Omaha. I could live in Sarpy County or Papillion as well. So it's difficult to compare across. That's why most of the time when we compare numbers, it's cases per 100,000 per day. So we take the population, we compare cases per 100,000 to the day. That's the best, positivity rates and some of the other things that we measure. Cases per 100,000 per day is the best measurement to look at, because then you can compare counties across, because you can see cases per 100,000 per day. In Sarpy County, we don't have specific cities. Sarpy County was over 100 cases per 100,000 per day, the rolling 7-day average. Omaha was similar to that. In Douglas County, if you go out west, we have cases up to almost 300 cases per 100,000 per day in western Nebraska. So that's how you can compare cases per day. Yep.
Anybody else? Thank you very much.
Thank you.
Next proponent? Any opponents?
All right, Melissa Panko, 503 South Madison Street. Sorry, I'm pulling my notes up here. Well, thank you for letting me talk tonight. I appreciate it. My main concern is not about wearing masks. It's actually about government overreach. And I think we're doing a really good job. Whenever I go out, people are wearing masks. I'm going to give you 2 examples. I ran 5 errands in 1 hour, which makes me like Superwoman to go to 5 stores. But they're quick in and out places. Not one single person didn't have a mask on, not one. And so that's great. Then I went Black Friday shopping, and my husband was excited, from 5 to 11. And I saw 2 people without masks in 6 hours at Shadow Lake. So one man didn't have one on, the other one had it pulled down, and they weren't anywhere close to anybody. So that's 2 people. Do we think those 2 are causing the spread? No. Okay, sorry, I got nervous. So people are already complying. So why do we need a law to mandate something that people are already doing? Like they were talking about like people, oh, if we can just get it higher, right? Let's just get it higher. Well, it's already so high. So what is a mandate? Does it take it to 100%? No, the ones that aren't wearing a mask are not going to wear a mask. So now we're asking the police department to do that. And that just, I don't know, that doesn't make sense. So I don't know how to work this. Is it? Oh, thank you. This is what you provide. Is this the right direction? Okay, so this was everyone's been talking about this. It's hard to see, but it does show that the rate in Kansas, because this is what you guys provided in the packet. It maintained once the mask mandates were in place. So that's great. However, it stopped in October. So if we look all the way through November to today, it's gone up. So did people stop wearing masks? No, it got colder. People went inside. Like, it's not spreading because someone at the grocery store walked by someone. It's spreading because people are gathering together. So anyway, I can share this if we need to, but
When you're done, if you want to give it to Ms. Brown, we'll have it for the record.
perfect. Okay, so my last point, let's see. Sorry, I lost my place. People have complied. We have done a great job as a city, I think. Like, when I look around, I think everybody's doing it. And I think if you pass this, it says to the people of Papillion that we are the children in the relationship and you guys are the parents. And I don't believe that's the role of government. I don't believe most of you do either. And so I would appreciate it if you would take the responsibility you've been given with great honor and use it wisely and let people know that you respect them. So that's all I have to say.
Ms. Panko?
Yes, sir.
You
I'm
know,
much
you-
better at just
Yeah,
questions. So.
you said something that has troubled me,
Okay.
you know, and that, yes, I agree with you, that you walk around and you see a very high percentage of people wearing masks. And then I see the people who don't wear the masks, and I often wonder why. And I take it that some people medically can't. I accept that.
Sure.
And then I see that other people are doing it for many reasons, but including it's a screw you, up yours type
Sure.
attitude. Well, I had somebody tell me that, well, one of the obligations we have here as elected officials is to lead people into responsible behavior. And I thought, yeah, I guess so. You know, we're held to be responsible, and that's part of what we're supposed to be doing here is leading into responsible behavior. So I'm thinking, okay, much like a speed limit. Well, most people who are going to drive, I think, are going to drive responsibly. So we don't have.
I don't know.
Well, we don't have speed limits for those people. We have speed limits for the irresponsible people. And I
Well-
thought, well, isn't that true of, you know, I don't want to make a speech, but isn't that true of what we're doing here also?
Well, do you really think that we have speed limits for the irresponsible? Because at the end of the day, the responsible people are the ones that go, oh, I better slow down. It's
Well,
the irresponsible that are not listening.
when I drive to Lincoln and I'm driving 70, 72.
Oh, you get passed. I
Yeah.
hear you.
And the guy goes by-
Everybody
The
passes
guy
you,
goes
right?
by going 100. I'm thinking, give him a ticket.
Oh, I
think
agree.
That's the speed limit.
I agree, but my argument is we have such a high rate of compliance right now. Because a high rate of compliance, the people you're talking about are so low. Like literally when I was at Shadow Lake, people are outside walking through parking lots by themselves with a mask on.
Well,
I mean, that's great for what you're trying to do. It's already being accomplished. So if we're looking for those few people that are saying, screw you, I'm not going to do this, right? Is this going to, are they now going to listen? Because that man driving on the interstate going 100 miles an hour, it's not the first time he's done that. And I bet you he's gotten a ticket. So I just don't know that it's going to be, what are you trying to accomplish? Because back to the Johnson, I didn't give the data that I shared was from Johnson County. It's Overland Park area. And they're still wearing their masks, but their cases have gone up. So that didn't have, like it had an effect for a while that it was maintaining. That's great. But there was it's not that people stopped wearing them.
You know, I'm going to tell you that you made a good point, and I agree with you a whole lot. But you don't pass laws that are not going to accomplish anything.
Exactly.
And so I sit and I think, what are we accomplishing?
And I don't
Um,
know with the high rate of compliance already, like,
Well, but
where
then-
is it that you're trying to make sure this is happening? I think that's a great question for the council to say, you know, this isn't happening at these stores. And so this will make it, because it's not, like, I believe that I'll be able to not have to wear one in a park, right? Like that's not part of this. So it's specific to,
Yeah. See, and
So-
and I don't know the answer, but I know that the previous speaker said, well, okay, history tells us like seatbelts and all. Yeah, there are those people that are not doing it now, they will do it when there's a penalty. Now, maybe, you know.
but I also
that's where
think
we go.
people, I think people wore seatbelts in the 80s, but they did not wear them like they do now.
Okay,
Like
agree.
I know the car seat that I was in, and it was like, we never wore seatbelts. So don't tell the police, but
I'll just tell you, you've raised a question that has been troubling me. I don't know the answer to it. Thank
yeah,
you.
all right,
Thank you.
all right.
And
This-
just a quick comment, Melissa's on our library board of advisors, which is an appointed official. So thank you for your service to the community. Yes, sir.
Hi, I'm Pete Dusky. I'm from 301 Fall Creek Road. I guess I'd like to preface everything by saying I absolutely believe this virus is real. It's as real as all the other viruses that are out there, like the 100,000 of them that are probably in this room right now. I have 3 very close family members that are all in the highly susceptible category. And so I take their health very seriously, my wife being one of them. But I want to ask you a question. Has any of you, anybody in this room, ever seen any definitive information about what is the most common spread of the virus? I don't see anybody getting up, but I saw a healthcare professional get up here a few minutes ago wearing a mask who proceeded to touch everything on this platform. So,
Please, no comments from the audience.
So this is a gentleman that said he was about trying to get people to modify behavior. This is a person that should be above all people, somebody that pays attention to how viruses are spread and where you can pick viruses up from surface. And yet this person touched everything in this vicinity, which I'm not going to touch. Okay, but I might be breathing on that. But do you realize how many viruses right now, all of you can touch right now? Every day we're subject to, and you can look this up, millions of viruses in our environment. Millions, literally millions of viruses. For the most part, our bodies and our immune systems handle them just fine. So let me ask this. Have any of you here, or do you know anybody on the planet that can smell a virus? Anybody? Volunteers? Anybody?
Public hearing is for us to take testimony, not for
Sorry.
Q&A.
Sorry, trying to make a point.
No, it's a good call. It's
Now
good
this might be a little
clarification
crude for
so
some
thanks.
people, but have you ever smelled your own fart or someone else's? And do you know why that is versus why you can't smell a virus? Because the molecules of a fart are a lot bigger than a virus, much bigger. And I'm pretty sure there's not too many people that go commando all the time. But most people change their clothes twice a day, or maybe once a day, but they've got 2 layers. If we don't know how viruses are spread or picked up, who's to say it's not picked up by people's shoes? People walk everywhere in the same places other people walk. They drag what's on their feet through town, through their house, through their school, through hospitals, through elevators, through all sorts of places. And if you looked, you'd find out that researchers will tell you, you walk through viruses all the time. The thing that drives me crazy is when I go to a place, and I do wear masks when I go into mandate places, is when there's someone in there with the most god-awful cough.
2 minutes.
And I run. because you can't legislate stupidity out of people. By putting in a mask mandate and not stressing time and time again that if you're sick, if you have any type of sinus or respiratory problem or a cough or a tickle, you should not be out in public. You're going to get the same people that I run into wearing a mask and thinking they're okay. And sure as anything, they're spreading the virus rampantly. And do you want that to be your decision, that you encourage people that they're okay? I'm wearing my mask, so I'm going to go out like nothing is wrong. And I really don't care if I'm coughing because I'm wearing my mask. Since we don't know where the virus is coming from or how it's spread,
1 minute.
how do we know that masks are helping? That's all.
Thank you. Next. And as he's coming up, just since people are coming and going, I'm going to stop doing proponents. Opponents we'll just do next. So go ahead.
My name is Peter Mayberry. I live at 11409 South 122nd Street, Plain, Nebraska. And I actually just came here today. I was going to give kind of what I felt, but I saw these educators and I saw these doctors and agreed. The guy was touching his face. He was touching everything. I actually couldn't believe it. And I also saw this educator talking about the different schools. Like I know Cornerstone Community down in Bellevue, they've never had a mask mandate. None of the students wear masks. The teachers don't wear masks. No one's ever got sick there to my knowledge. And I don't know what they're doing differently. Maybe I guess Jesus is the cure to the COVID. I don't know. But I'll also tell you that I have the distinct, everybody says these visions. And the one guy was like, he has little babies dying, which I don't even know how many babies have died of COVID. So I can't imagine he had babies. But I just feel like this is all hyper sensationalized. Steve, you're great. I'm going to get you a donation. I believe in everything you're saying. But I'll tell you now, I go to 68107 every single day. And I also have the distinct pleasure of being the first person in the city of Omaha to have the mask mandate fined against me. And I'll tell you, I've never wore a mask. I don't wear a mask because I have asthma. I did wear a mask at first. I was in Sam's Club right here in Papillion. I almost passed out, and to their credit, an employee of Sam's asked me if something was wrong. I took the mask off. I was sweating. I said, I'm having trouble breathing. And she literally said, you don't have to wear the mask. And I didn't wear it since. And I do. Like when I restrict my breathing, I do have I start wheezing. It sounds like a whistle. But I will also tell you, my laundromat that I own right next to Greater Omaha, which is 68107. If you look at any map, it's the brightest red. I've gone there every single day since this happened. I wore a mask for the first 2 weeks because I was also scared because they said 35 million people would be dead by now. 35 million people. That is what we were all told. 10% of the population of the United States. I'll tell you another thing this mask is doing. Now people have been so pushed on this and it's been forced on us that I actually hope to God that we don't have something really serious. Because this is about H1N1 was 60,000. We didn't do anything. This one is 2, 4, I don't even know. But there's been 900 people die in Nebraska. There may come a day where there is something very serious and people, it's like crying wolf. Like people aren't even gonna take it serious because they're gonna see all this hyperbole, put the mask on. I agree 100%. I see these memes with people saying wearing pants and peeing, like liquid is oxygen. But like I digress, I'm getting off. I came here only for the business thing. As a business owner, like I said, I heard these guys. So I actually just came here to say, I'm a business owner. I was trying to do the rules and everything else. And I had an employee be assaulted. She had a trash can physically chucked and hit her in the head over this. And I've had arguments, I've had threats, I've had both sides. I mean, there's extremes on both sides. There's extreme anti-maskers, there's extreme maskers. And like when these two people meet, it just causes this chaos. And like I had employees get put in the middle of it. So I literally told them, which I also told the mayor, Gene Slaughter, and I told the Omaha police several times, I don't want them to be in the middle of that. Like I literally had someone in a dangerous situation where, I mean, this is a trash can this large. She was a 60-year-old woman and had chucked and hit her in the head and knocked her to the ground. I mean,
2 minutes.
And that's kind of what my point is. Like you're putting people in impossible situations. I also think that I have never worn a mask. I've been in the worst zip code for it. I've never had an employee test positive for COVID, and most of them choose not to wear them. I've told them, you wear them. I'm happy for you to wear them. I'm happy for you not. So I just think, I don't think it's as dangerous. I believe in it. I mean, there was a guy who said that I think everybody believes in it. I just don't think it's as serious. Like I know like something like 200 people have gotten COVID, and the majority of them, the worst things happen is they lost their sense of smell and their sense of taste. And if I have had COVID the whole time I've been down there, I can 100% tell you, 100% certainty with no lie, that I would rather have COVID again because I didn't even know I had it than have the flu. And that's honest God truth. All I'm saying is I'm a libertarian too, so I just don't want civil liberties trampled on. And I think you talk about laws and seatbelts and that's fine, but like you get a slippery slope, right? I mean, even when you talk about gun laws, you give a little bit and all of a sudden it slips off. I mean, it just goes off a cliff. Like, where do you draw the line? When you start redrawing lines,
1 minute.
you start to lose where the line was. And I'm done. That's
Oh,
No,
hold on,
sir.
Mr. Mumgarden.
You said something that intrigues me, as a business owner.
yeah,
Okay,
it's a tough spot to be in.
well, okay. I'll tell you a story about, I was talking to a business owner, a guy who owns a business, several businesses in Omaha. This was early on when Omaha passed their mask mandate. And he was telling me that he found himself, before the mandate, he found himself in the same situation that you were just describing. That when people would come in, he wanted to keep people safe as employees primarily. So when people would come in without a mask, I mean, he would recommend a mask and he would ask them, hey, can you put on a mask? And he said that that wasn't working. And so then when Omaha passed their mandate, he was no longer the bad guy. He could just say, hey, look, I'm sorry, but you have to have a mask on in here or else I could get a ticket. He was very glad as a business owner to have that mandate for that reason. What's your reaction to that?
My reaction is I don't tell grown people how to act. Like, I don't want to force my will on anybody. And I don't know, like, I actually have an employee that asked me if she had to wear a mask and something horrible happened to her and she had a reason for it. So like, I mean, I carry a gun. I mean, people carry guns, people wear masks, people don't wear masks. Like, everybody has a reason for doing something. And I don't believe, and I also feel it's ridiculous for me to have to like carry a card to say I have asthma and that it restricts my breathing. And I begin to wheeze. I mean, and I'll tell you what, like at first people even respected my right. Like when I said, I don't wear a mask because of health concerns, but then like people found out that this was a way that if they, like you're right, some people just want to be a FU, they don't want to wear a mask. So they said they have a health concern and they found out that is. So then people started pushing back on that and actually asking people to produce proof and everything else. So I'm saying like, I believe a lot of people have a reason to do whatever they do. And it doesn't necessarily mean I need to know what it is. But again, as I said, I'm a libertarian, so I believe in the whole thing. Don't tread on me.
Thank you. Next. Thank you. Next. Even though everybody knows you, you still got to do your name and address for the record.
Okay. And I didn't put this shirt on. It's just happened to be what I wore this morning. So I haven't changed my clothes yet. I'm Gene Fall, 1915 Peterson Drive in Papillion. I have a business here in town, Gene's Auto and Truck Service. And we do not have a sign on our door that says you must wear a mask. I would say majority of the customers that come in do wear a mask. A point that my daughter made, I went out Black Friday shopping Friday, 6 o'clock in the morning on Ards and a few other places. I didn't see anybody without a mask on. And I would have to say every time I go into a store, if I see the sign, I put the mask on. If I don't see the sign, I'm not putting the mask on. And I don't want to, if I have to make our business that way, I guess we're going to try a plastic shield. Hopefully that's legal. I don't know. That's some things we need to find out. I'm hoping somebody's already brought up the fact about the constitutional rights and things like that. I'm assuming some of that was mentioned last night, maybe. So I don't want to rehash all that as far as taking away our rights. I do hope that, and I want to find it here real quick. I had said something to Mayor Black and he was going to pass it on, and I'm hoping he did pass it on. I hope you guys had time to read it or will.
The item you sent a couple days ago, I did
Yes.
forward that to everybody.
Okay. It was from the, oh gosh, now I can't even think what it's called. From the Liberty Sentinel, I think it was. And it's a biblical view on wearing masks. And I do believe that if you read that, you'll understand. I don't need to rehash everything that was written in that, but I do believe that we have a right to live our lives under laws, and we will obey laws. And if we don't, we should be, we should have consequences if we don't obey laws. And I get that. What I don't want to see, and I'm very proud of our police department, I don't want to see them have to run around chasing people
because they don't have a mask on when they've been brought up to chase masked people. I mean, they should be chasing the bad guys, and they shouldn't waste their time with this kind of stuff. And if they're bored, there's tons of speeders out there and red traffic light runners and everything else. So I don't think you need to saddle them with, go arrest this guy because they don't have a mask on, go fine him. I don't think that's right. And that's about, I just hope that you'll consider some of these things. And most people are wearing them anyway when they need to, so that's all I got.
Thank you. Next.
Hi, I'm Tiffany Hansen, and I live at 1701 Savannah. Governor Ricketts issued an emergency declaration on March 13th. On September 14th, he announced, "We are loosening restrictions. We are no longer in an emergency. We are in the recovery stages. You cannot be in the emergency room and also in the recovery room. Emergencies don't last 8 months. They are categorized or defined as immediate and sudden. Declaring this ordinance does not absolve you from violating the laws." When Councilman, Stubbe asked yesterday or in one of the ordinance papers, what authority the police had regarding mask enforcement on public property, Police Chief Lyon stated they have none. So I don't understand why we can even have a mask ordinance. And then lastly, this ordinance discriminates against, this ordinance discriminates against the Nebraska Constitution, the U.S. Constitution 1 and 4 amendments, federal civil rights, Title 11 and Section 2000. It also violates Nebraska civil rights laws. You cannot tell someone they can't go into a business. And if this is filed, then I will file an affidavit of notice of discrimination against everyone because it's unlawful. So that's all I have to say, and I'm done.
Thank you. Next.
And if anyone wants any, I have a whole bunch of extra copies and you can fill them out too.
Next.
Hello, my name's Aaron Sandine. I live at 918 South Harrison Street. I was listening to the health professionals earlier and I was a little shocked. They didn't actually have any science behind what they were saying. They had stories, and they're terrible stories about people dying, but they didn't have any actual science behind it. So I thought I'd come here and present a few studies. The country of Denmark just recently completed a study with 6,000 participants, and they found that they had a similar rate of infection between people that wore masks and the people that didn't. The University of Poland, they had a rate of confirmation of laboratory confirmed viruses that was much higher for cloth masks than for medical masks, or groups that did not wear any mask at all. So they actually found a higher rate of infection of people that wore cloth masks than anybody else. The Vietnamese study concluded the rates of all infection outcomes were highest in the cloth mask arm, end quote, versus no mask and medical masks. Quote, penetration of cloth masks by particles was almost 97%. U.S. Surgeon General Jeremy Adams said that, quote, the data doesn't show that wearing masks in public will help people during the coronavirus pandemic. And our own vaunted CDC released a study in May of 2020, quote, we did not find evidence that surgical type face masks are effective in reducing laboratory confirmed influenza transmission, either when worn by infected persons or by persons in the general community to reduce their susceptibility. And the CDC just completed a study again in September that confirmed their previous findings. So.
Thank you.
Thank you.
Next.
My name is Drew Fletcher. I reside at 10620 South 110th Avenue here in Papillion. Been here about 8 years. I have a career that's based here, and my wife and I also have a small business that's actually based in Douglas County where a mask mandate is in effect. I had sent emails, many of you, I'm sure that it's in your packet, so I don't want to rehash all of those points again. I want to bring up just a couple of ideas. The first one is that this is becoming a very emotional thing. While the registered COVID nurse that spoke earlier, I listened to him, very eloquent in his words and very compelling in his stories. But I couldn't help but notice that the wordsmithing and the choice of colorful language that he used was there to evoke emotion. Folks, this is not or should not be an emotional thing. It should be based on data, logic, and an amalgamation of priorities. It is no surprise to me that the County Board of Health voted 5-0 in favor to push this to you for consideration. But that's their job. Their main objective is 0 infections. That's their objective. And in achieving their objective, the mask mandate would be a very good thing because they have no other tools in their toolbox until a vaccine gets here, which is very close. So I understand, and it made no surprise to me at all. But your job here as a city council is not to pick up just one priority from one point. Our community has many different priorities. Priority of low infection and public health, granted. But we also have priorities of economy, of psychological well-being, of community getting together and working together. And what's happening here is we are dividing people very drastically because it's based on emotion. We need to have a measured, weighted, and logical approach to this situation. And while there's been many points of data thrown around here, one of the first things I learned in university statistics class is that figures lie and liars figure. I can cut a data set to make it be anything I want it to be based on how you set the parameters. So when people give you data one way, I can give you data the other way. So let's just take data out of it. Let's put it in real life. I have 2 sons. Both sons live with their girlfriends. And both households, one of the partners in the house was positive for COVID. The other partner in the house was not, and they did not separate. No masks, and only one got infected. That's real life from my world.
2 minutes.
So my question is this mask mandate really, really needed? As it's been said many times, a lot of people are already complying voluntarily. What this mask mandate is asking to do is to criminalize it. And we don't need to criminalize our non-criminal citizens. The other point that I do want to bring up is one of the speakers earlier, he admitted that it's not going to change the infection rate, but it's going to change behavior. Folks, we're after trying to reduce the infection rate, not try to change behavior. So that tells me it's really not about the virus. It's about control because you're controlling behavior. I give up the rest of my time.
Thank you. Next.
I'm John Jewell. I live on 1011 Haverford Drive here in Papillion. Just a little bit about me. I work at Travel and Transport, who recently has been acquired and bought by CTM based out of Australia. Travel and Transport, as hopefully most of you know, was a 74-year-old company that was Omaha based. And so this has impacted my life in a profound way. I had to furlough my entire team. I had to fire 2 contractors, and I've been working on reduced hours and reduced pay since March. I can appreciate, what he said, that there's emotions that are high on this, and also talking about data and statistics because that's what my career is in. I work in business intelligence, data and analytics. I've worked for Microsoft. I've worked for the Bill and Melinda Gates Foundation out in Seattle. But if we ignore logic and statistics, then all we're left with is anecdotal evidence. And so what I want to present is logic and statistics that I have. Bear with me one moment. sorry.
No worry.
Okay, so this is just something that I wrote, that I shared. These are my thoughts on about COVID, because I've read so many comments below articles that have been shared from the Omaha World Herald and KETV, which I'm sure you all have as well. Far too many comments on news articles which errantly say that it has a 99.8% survival rate to justify not wearing a mask. So why do I say errantly? Number one, you don't include people who never had COVID in your survival rate. Think about this for a minute. We all know someone who has survived cancer. For those of us who have never had cancer, would you buy and wear a shirt that says, I'm a cancer survivor? It's the same with COVID. If you never had it, you didn't survive it. The survival rate is actually 96.77% globally. It's 96.78% in the United States. You compute that by taking the number of deaths divided by the total number of resolved cases. Another way that people try to skew the data is they take the number of deaths and they divide it by the total number of cases, not just the number of resolved cases. But that is going to skew the data. That's going to skew the number low, because it's going to assume that all of the people who have COVID that have not yet been resolved are all going to survive it. So one last thought on this is that according to 2015 statistics from The Economist, your odds of dying in a plane crash are 1 in 11 million, or 0.000009%. So that means if you get COVID, you are 357,778 times more likely to die than you are when you get on an airplane.
2 minutes.
An airline company would completely collapse if passengers had a 3.22% chance of dying on that airline's planes. Would you buy a ticket to fly on the airline's planes? Hopefully not. Let's see. One other thing is I also wanted to compare our country against a country that has a mask mandate. When you look at Japan, which has a population of 125.9 million people, 150,386 cases, 129,476 of those cases have an outcome, 2,172 deaths. Their positivity rate is 0.119%. Their survival rate is 98.3%. Their mortality rate is 0.0017%.
1 minute.
And in the US, where we have a population of 328.24 million people, we have had 14.31 million cases, 8.74 million cases with an outcome, 279,845 deaths. The positivity rate in this country is 4.36%, which is 36.5 times that of Japan. The survival rate is 96.78% here, which is 1.5% lower than Japan. And the mortality rate is 0.0853%.
30 seconds.
The average flu kills 36,500 people per year. COVID-19 annualized is going to kill 336,000 people, which is almost 10 times that. And that's with a lot of people going out wearing masks, trying to safely social distance. But as you know, not everybody's following those guidances.
Thank you. Any council questions? Thank you. Next.
Hi, I'm Tina Lassick. I live near 36th and 370. I'm a senior citizen, and I know I positively cannot wear a mask. I know you've heard a lot of statistics.
Can you pull the microphone down just a little bit?
Yes.
Thank you.
Short people. You've heard a lot of statistics, so I'm just going to share my life in 2020 from my perspective. In March, I had COVID. I'm in the second highest risk category. I was well prepared ahead of time and didn't need a doctor or any medicine. I made it through this flu just fine at home. For the first time in my life, I've had to deal with constant bullying. Prior to Omaha's mandate, when masks were a choice, people left me alone. Because I don't wear a mask, I have never worn one the whole time. The Omaha mandate passed, and August 11th, terrible bullying started happening. At that time, it was extremely obvious that almost 100% of Sarpy County citizens began wearing masks at all times. I live in Sarpy. It's pretty close to 99.9%, and you know that. So where's the emergency? Why do you think a mandate is even necessary? Recently, Costco and natural grocers changed their corporate policy. I've been able to shop in those stores the entire 8 months without a mask. They were strict in other states, but let it slide a little in Nebraska because we didn't have any mask mandate. And that's what the managers told me. I know these guys, shopping there for years, thousands of dollars. All of a sudden, after these mandates, they won't let me in the door. And that's corporate. And I know it's not on your shoulders, but I need a highly specialized organic diet with everything made from scratch. I was getting 80% of my food from natural grocers and the rest from Costco. Now I have to shop at 6 different stores to try to piece together some of what I need and get meat and eggs from farmers and veggies and berries and kombucha. You can't buy that kind of food online. I have massive food intolerances. So I'm actually having a hard time finding food. If Papillion passes a mandate, I won't shop here. I won't shop in La Vista, just as I've been boycotting all of Omaha. An inability to buy food is scary and wrong for a senior citizen in the United States. I blame these new mandates. The managers have told me it's the reason. It emboldens the stores to slam the door on some of the most vulnerable citizens like me who can't wear a mask. Mandates created a new class of Karens bullying people in the stores, calling the police on their fellow shoppers, and this is un-American. Do you think that we haven't noticed that it's only UNMC pushing fear 24/7, pushing this agenda? I think they're compromised. They're very biased and they're set to make billions off of COVID. They developed remdesivir and they're in bed with China. And yet this is who everyone is listening to as if they're the authority of everything. I attended the Bellevue City Council meeting last night and I commend them for choosing to go with a resolution. They're asking nicely, they're educating the citizens, and I think that's the proper way to go since almost all citizens are complying. There's no need for the threat of fines or the fear of cops showing up when you're just buying food. I've completely lost all relationship with my 38-year-old son. He's terrified he's going to die. He
2
is
minutes.
a little bit on the autistic spectrum. He works from his apartment and he rarely leaves. He used to come for dinner every Sunday, but I haven't seen him since this started. And you know, that has to do with the mandates. You guys passing mandates, all of them popping up like mushrooms, that is making him even more terrified and confirming his fear. Points made at the Bellevue meeting last night, mask mandates are impossible to enforce. They're similar to a fireworks law. I keep hearing people say seatbelt law, but no, one of the Bellevue councilmen who used to be a police officer said it's similar to fireworks law. Completely impossible to police. It wastes so much police time that Chief Clary said the number of people calling all hours would sink him because they're already at capacity. We need he would need a lot more police.
1 minute.
If your police are wasting a huge amount of time on this, how good will they be at responding to a true emergency? The Bellevue City Attorney said people will likely contest the citation and refuse to sign it. They're going to end up with tons of bench warrants over a stupid $25 fine, a huge waste of time and money. This whole mask agenda creates more problems than it solves. There is a risk, and when there's a risk, there must be choice. Give me liberty or give me a 0.02% chance of death, people. I have had COVID months ago. You know, like I said, I made it through. Why don't you take a cue from Bellevue and just pass a resolution? Why are you copying what Omaha did instead of standing on your own 2 feet? Keep the small town friendly feel here in Papillion. Thank you.
Thank you. Next,
I have a question.
Mr. Sunday. Ma'am?
I'm sorry.
Number one, hi.
Who's speaking?
Right here.
I actually read lips, so I can't. Just to make life more interesting, I'm very hard of hearing. I need
We
to read
did
lips.
pass a resolution last night, actually, so we
Okay.
already have that in place. This is what some people want to do in addition to that.
Okay, thank you. I was at Bellevue last night, so I missed it.
No, that's okay. But the question I have for you, since you've had COVID and I've had COVID and I know Mr. Mumgard's had COVID, is there any reason why people that most likely have an immunity now should be having to wear a mask anyway?
Oh, no. One of the problems we have, though, is, you know, somebody like, I'll name names, Mr. Bill Gates, he wants to microchip you. The only way to prove you've had it, you know, you got to have tests, and then you'd have to what, have a health passport like they have for the airlines that they're getting started. I am not in favor of health passport. So you're going to have to take someone's word for it, or it's going to get super ultra over government controlled regulated.
Okay, thank you.
Thank you, Mr.
Next.
Sunday. Am I going?
Pardon?
I can't hear anybody, so
Oh, you're done. Thank you.
thank you.
Next.
Hi, my name is Melanie Donor. I live at 16205 Chicago Street. I grew up in Papillion. I went to Papillion High School. We just recently moved out of Papillion, but all of our doctors are here in Papillion. Our dentists or orthodontists are all here in Papillion. We actually come to do our shopping here in Papillion because we don't feel comfortable going in Omaha. I have a blood disorder. My blood disorder causes, well, I basically don't have enough oxygen running through my body at any time. When I wear a mask, within about 5 minutes, I start to pass out and I will fall on the ground. When I was pregnant with my daughter, my fifth daughter, or my fifth child, I would walk through the stores and people would yell at me. And I would try to explain to them. I'm done explaining. I actually walk through holding a shield, but I don't put it up in front of my face because I know it doesn't really matter. My concerns are for the children though, as well, wearing a mask. Imagine you have a baby and they're in childcare all day long with someone wearing a mask. How is that child going to learn how to smile? Because they never see you smile. Are any of you familiar with RADS? Reactive, you are. Okay, so you understand. A child who does not see a face or doesn't experience true love, which they need to see that in the expressions of people, it turns out very bad for their psyche. And pardon me, I am a little nervous. I was not planning on coming up and speaking today, so I'm not fully prepared. But these children that are in the public school system wearing masks for 7 to 8 hours a day, they're touching them, they have bacteria, they keep breathing that same bacteria in, they don't get to see their friends. I've walked up to people who are wearing their masks and I didn't even recognize who they were until they pulled it down. Imagine you being with your friends and you never actually know who they are because you've never seen them without their mask. That's just crazy for me. I haven't even gotten to any of my little points that I jotted down. So they talk about wearing masks in the hospitals. Well, when they're wearing masks in the hospitals, as soon as they leave the room, they take everything off and put a new mask on. We're wearing the same one. We're touching our face. We're touching it all day long. You wear the same mask all day long, or you have the same mask in your car. If you're a virologist, someone who studies viruses, you're not just wearing a mask, you're wearing a full body suit and you're getting oxygen from a different room. That is the only way to fully know that you are not going to get affected by that virus. So wearing a piece of cloth over your face just to make someone feel better, I think it's ridiculous. We come to Papillion and we spend our money here because I feel safe. I'm not going to get yelled at. I'm not going to have someone throw things at me. I'm not sick. If I'm sick, I'm going to stay home. I'm not stupid. I'm not going to do something idiotic and take my sick children out in the public. It doesn't happen. But my kids don't get sick because we take vitamin D. We do elderberry syrup. We take vitamin C. And when you take your vitamins, you're less likely to be affected by these viruses. So why isn't anyone mandating that everyone take vitamin D? I don't know. That might be a good idea because people would be less likely to even get sick. I'm sorry. I think my daughter just spit up.
Somebody will clean it up.
I apologize. So another thing, when people are going and getting tested and then they end up being positive, they're sending them home. No one's going to the doctor's office. No one's getting treated. So why are we doing that? You send them home and you make them quarantine. And if they get really sick, then they go to the hospital.
1 minute.
And then they treat them just however they feel like treating them. And that's why they die. They wait until the very end, until they are gasping for air instead of treating them. Okay, you're sick, you have a few symptoms, you've tested positive, let's treat you. Or you can wait until the last minute you're dying, put you on a vent, and then you definitely die. Or you isolate the elderly. Our grandmother has not seen the baby because she's so afraid of COVID. A baby's not going to transmit COVID. I'm sorry, how much longer do I have? Okay, perfect. The baby's not going to transmit COVID, but she's too afraid to see her. I know I'm all over the place. There's another comment that I have about, so when I gave birth to my daughter, 2 months prior, I got bronchitis. Bronchitis is not COVID by any means. But my coughs when I get bronchitis lasts about 3 to 4 months, and it sucks. If I would have given birth in the hospital, they would have taken my baby away from me because I had a cough.
Thank you.
And
Mr. Sunday.
Oh, I'm sorry.
Okay.
No, Mr. Ingberg.
Just a quick question for you, if I
Yes.
could. I thought I heard you say something about knowing you weren't sick or something. Maybe I misunderstood, but
If I'm sick, I'm not going to go out.
no, but here's my question. From what I've read, and everybody's talked about the data, and we should read medical and science. Way I understand what I found is, I don't know how you know that you're not sick because most of the population, they say, is asymptomatic. You don't show any symptoms.
Well, when you have the flu, do you know you have the flu? You do because you feel sick.
But my point is,
But if you're not sick, you can't pass anything. Either way, these viruses are around us all the time. There could be the COVID
No, that's
virus
not-
hanging out in here, but most of us are able to fight it off because we're healthy. We have immune systems.
no, that's not my question. My question is, when you go out and let's say you're against wearing a mask.
My kids won't wear masks. I won't cut off their oxygen,
Okay,
and
but
damage their
Never
organs.
mind. Never mind. You're not. The question I have is,
If you're asymptomatic, you don't. Here's the thing that's a bunch of BS. I mean, like you've never.
Hold on one second. Hold on one second. Let him ask his question,
Okay.
please.
my question is, if you're asymptomatic, in other words, you don't have any symptoms like maybe you would have with the flu you mentioned,
Mhm.
how do you know that you're not sick with COVID?
Asymptomatic was never an issue until COVID came up.
Never mind. Thank you.
Thank you. Next.
Okay. Am I done then?
Yes.
Okay.
Hello, my name is Heidi Ostwald, 1301 Choi Street. And I just wanted to let you know that I changed my behavior. I followed the COVID rules and I still came down with COVID. So I'm asking you the right to have the option now not to wear a mask because I don't know about a lot of people, but finances are tight right now. And I don't want to have to pay a fine. So that's it. Thank you for your time.
Thank you. Next.
My name's Nancy Doherty. I live at 1308 Cedar Woods Drive, Papillion. Heidi's my daughter. And our family has had COVID as per test from the doctor's office. I'm 73 years old. I survived. I didn't take any therapeutics. I just went home and did what most people do when they have the flu. And I was a healthcare professional some time ago. I was an RN, and I remember what my microbiology professor said, who had a PhD in microbiology. He said, think of yourself as a bacteria. This room is your host, or the person that you're infecting. Think of yourself as a virus. This town is your host. And if you've ever seen virologists working in a lab studying and researching viruses, they have on this hazmat type suit with their own independent, their piped in oxygen supply. And my daughter and I and our family, we wore masks where they were required and we still got the COVID. And so I got this mask to wear so that I could virtue signal to other people. And that's what I see it as, because in my opinion, the masks are ineffective. And that's all I have to say unless somebody has a question.
Thank you.
Mhm.
Next.
Hi there, my name is Christine and my address is 18904 Willow Street.
What's the last name?
Christine Bain,
Thank
sorry. It's been really frustrating for me because I actually worked at the Med Center for 10 years. And I will tell you that the med center is talking about the science, and I have been a healthcare provider for 13 years, and I've never seen the science before. I had to quit my job. I worked through the pandemic for 6 or 7 months, and in late August, I had to quit because I will tell you that it was not normal for healthcare professionals to wear masks throughout the hospital unless you worked in OR, and they have extra oxygen down there. I had to quit my job because I got severe headaches. I couldn't breathe. I was suffocating. I would come home in tears. Now I do not have another income in my household. Now they want to sit there and mask my 4-year-old and my 6-year-old. I'm not trying to be mean, but that is child abuse. There is no reason why a child has to wear a mask when they are not the carriers. Everyone, Dr. Fauci just came out the other day and admitted and said that children are not the carriers. And I guess I don't understand why children are wearing masks for 8 hours. These kids are getting terrible headaches. Parents are having to try to find, to homeschool. And I'm unfortunately having, problems with my 6-year-old. We do e-learning. It does not work for a 6-year-old. I am tired of people looking at me and my children like we are the plague. Let's talk about cross-contamination as a healthcare provider. You cannot physically tell someone how to wear a mask. I know how to wear a mask because I was a medical professional. I go into public, people are touching them, they have them on their chins, they have them on their mouths. That does nothing, okay? I wore N95 masks in a TB room, okay? And we would take all of our PPE off and discard it in a biohazard bin, and we would leave. So this science that the Med Center is talking about, I had to leave because I can't sit there and support the lies. There is something else going on here. And let's talk about the flu. Where'd the flu go? If you look, the flu is gone. I will be honest with you, I worked in the lab and the numbers are being skewed. It's not positive cases, you guys. I'm telling you, one day a person could be positive, then the next minute they're negative. You honestly would have to test someone for 10 to 15 days, whether or not if they have COVID.
2 minutes.
Anyways, my point is universal masking, we just can't control it. And the thing is no one talks about, these people that are getting bacterial infections, they're getting bacterial infections. You're putting a cloth over your face and people sneeze into them and cough into them. And my point is I don't know when you guys think this is going to end. Like, it's never going to end because you cannot physically stop a virus. Unfortunately, I see people and they literally will go up to my face and they're wearing a mask. The virus is on your hands. The virus is on tabletops. So I don't know why everyone thinks this little piece of cloth is going to do something. And my brother is a firefighter. And literally, I will tell you that it has gone through their whole entire fire department. And there's about 20 of them that have had it. They wear N95 masks. N95.
1 minute.
So my point is a piece of cloth is not going to stop a virus. Unfortunately, we need to talk about vitamin D, vitamin C, and zinc. The Med Center doesn't talk about that. So my point is I think we need to educate people because masks are not going to save lives. Thank you.
Thank you. Next.
Hi. My name is Brittany Bundy. I'm at 107 Q Street. I am here today against the vote of mandating masks. Since Omaha put their mask mandate in place, I, a person who has a medical reason to not wear a mask, Papillion has been my place of refuge. For me to shop freely without being afraid of fellow humans being so incredibly mean to me and my 3 children. I feel afraid to go out. Being a stay-at-home mom, going shopping was my out. Like, I love to see people, smile at people, see their smiles. Now I get none of that, and I don't even look at people's faces. I and many others have sadly had to take our business out of Douglas County, and fortunately for your city, brought it here. We have been grateful to have a place that we feel free to choose. Unfortunately, most stores already require them, so that has had its own challenges. Also, the majority of people wear them by choice, as many people have mentioned. I go out in public, I am normally the only person I see out not wearing a mask. So I don't think that the non-maskers are the problem. When we go out, my 3-year-old son always asks why people are so mean. And it just breaks my heart. I said, I don't want him to see the world so hatefully. So I tell him that he just cannot see their whole face. And this is damaging our children, and this is damaging our communities. What about hearing impaired people? What about our elderly? They're dying alone. They don't get to see their grandkids, their great grandkids. What about the suicides increasing by 50% since COVID? There's a lot of other questions that we need to be concerned about and things rather than wearing a mask. We keep talking about a virus that has a 99% survival rate. And then also I wanted to say, all these mask mandates have medical exemptions. And I hear people say, like councilmen saying, if you see someone in public, assume that they have a medical condition. That has not stopped people from attacking me and my children. I live in an RV in Lincoln, and Lincoln is by far the worst city I have ever been to. We've been to Arizona during COVID, we've been to Texas during COVID, and I'm from Omaha, and now we live in Lincoln. I drove here tonight to be here because this is where I shop from, Lincoln. I did some research on the mask mandated cities and states. I found overwhelming data that has shown 100% of them had low cases before the mandate, and within the next week of the mandate, being active cases skyrocketed. Sorry. If the masks, social distancing, and killing of all the germs isn't stopping this virus from spreading, we're obviously seeing that the virus is still spreading, then why force people into this mandate? Weeks ago, I was going on and on about how amazing the
2 minutes.
leaders and councilmen are in Papillion for giving their people the power to choose. Being here now is disheartening, and I'm sure you have been so aggressively pressured, which is sad, by the way, to pass this mandate. A great leader is one chosen by the people, for that leader will be kept by the people. This is about your job security now. And why now? We're 11 months into this pandemic. We know how it spreads. The hospitals are not overwhelmed, and the deaths have decreased dramatically. This nonsense must stop. I'll end with this quote from Robert A. Heinlein. There is no worse tyranny than to force a man to pay for what he does not want merely because you think it would be good for him.
Thank you, Mr.
I
Mumgarden.
have excuse me, ma'am. I have a question for you now. You and several people have talked about not wearing masks and the harassment and bullying you get.
Yeah.
Now, I condemn that. That's not the way responsible people should act.
Right.
But we've also talked about how the vast majority of people are wearing masks.
Yeah.
What I having difficulty with is what difference, if we pass this, how would that change the harassment and bullying situation?
From what I've seen from the different places that I've traveled during COVID, you can look at Lincoln, and I think everybody sees Lincoln as the worst place. The mayor, the council people, they're all spreading fear. And I think it's the constant like attacking of businesses that aren't mandating the mask, and it's putting fear in people. I've never seen such fearful people until I moved to Lincoln. In my heart, I am a Christian, and I feel so sorry for those people. And the fear is what's killing people.
Well,
and it's
sure.
these mandates that are making people more fearful, because they're thinking, well, gosh, they're passing a mandate. That's serious. Like now we really it must be really serious, because now they're making us wear masks.
Mr. Mumgarden.
Well, I guess I look at, maybe I didn't understand it, but you said you come to Papillion to shop because we didn't mandate a mask.
Mhm.
You left Omaha,
Mhm.
but yet you still got harassed and bullied.
Mhm.
And so I'm looking at the harassment and bullying must be a different problem than is addressed by the masks. But you're saying, no, you think it's even worse in Lincoln because of the mandate?
Of the mandates, yes.
Okay, thank you.
Thank you. Next.
Good evening. Thank you for letting me speak. My name is Mary Heitkamp, and I am from 4865 F Road, Dunbar, Nebraska. And I am coming here tonight because I do come to the bigger cities, at least I did, to shop. And I have been coming to Papillion and to La Vista and to Bellevue now with what's been going on in Omaha and Lincoln. And I stand before you, and I'm sure I look very normal to you. But I do have an illness that actually affects my brain. And so if I always say glitch, I glitch a little bit with my speaking, you'll understand why. But I do have a health condition, and my doctor has told me that I should not wear a mask because of this. Now, people seeing me are not going to know that. They're probably not going to believe it, but it is true. And it is very important for me to have the oxygen that I need. I do know that this is not a hoax. I have had 9 family members that have had COVID, including an 86-year-old father-in-law who was in an assisted living home. And we broke him out of that because he didn't want to stay. It was killing him to be there and to be so secluded. And it was after he got out, a couple months later, that he did get COVID. He is what you would call very high risk. He has COPD. He is a cancer survivor, and he has heart disease. And you know what? He did great. And I will tell you that because of this research that I have done and the scientific studies that I have seen and the numbers in the different countries that do not have mask mandates and the different things that you can find if you do the research yourself and not just listen to the supposed experts. But if you do this research yourself, you will find that these masks do not do anything to stop the spread of the virus, as you have heard from other people. When I went to see him, he was actually in a hospital that allowed visitors, unlike I think UNMC. There's a lot going on with UNMC. You've heard that from a number of people, and I think people should be looking into that more. But this is a hospital that did allow visitors. I went in. When I was in, I took my mask off. When I was with him, I'm not afraid of it. I know when my time is up, it's up. And this virus is not going to change a thing one way or the other. Being immune compromised, I did not get that virus. I've been without a mask this whole time, and I have not gotten this virus. So just know that. I am concerned about what we are doing to our children. And I think it's really important that you think about the hypocrisies that go along with this. How is it that we can walk into a restaurant, we have to have a mask, but somehow when we sit down, we can take them off and the virus just magically stops? If you think a virus doesn't go over top of your plexiglass when the air is circulating all around, I'm not sure I'm really confused about the lack of common sense anymore. It's like, where has it gone? And if adults can sit at a table and eat with one another, why can't kids at school, especially these children who do not get the virus, who do not pass the virus on? Like they said, Dr. Fauci, if you want to believe him, which I don't believe a word of him, because I think there's a lot more to him too to all this, but he came out and said, oh yeah, no, kids, they don't transmit it. So why are we doing this to our children? Why are we doing this? I would encourage you to just look way beyond what you are being told. You have to do your own research. It is out there. And lastly, I guess I would say, what kind of people have we become? I look at what we have done. We are living in fear, missing time with family and friends. We're destroying our businesses, our economies. We're putting people against people. And yes, I will say too, with the mandates, the bullying has gotten worse. It has gotten worse. It has, because I think it's given them the authority to now be the bully to those of us who cannot wear it. But I'll tell you what, there were men and women that fought and died for our country They were willing, and yet we're willing to destroy our businesses. Who wants to go shop? I mean, I'm not going to shop where I have to wear a mask. I'm not going to do it. So I'll shop online before I do that. So anyhow, just things to consider. I thank you for your time, and I do hope you would vote against this.
Thank you. Next.
Hi, my name's Joe Leggett. I live at 7505 Overview Street. I got a bunch of chicken scratch here, and I've listened to a lot of this downstairs, and then the other downstairs, and then since I've been sitting here, and I think I'm going to throw all these out because I think, for one, I think optics are important. I was in my kitchen watching this on Facebook Live, and then I decided to come here. And the one reason I think that optics are important is because I looked at that image and I thought, oh my God, there's 3 people there. I need to go up there and take a stand and let people know that there's more than 3 people in the city of Papillion that are against this. Well, then I get here, there's not 3 people here. Like on the main floor, there's like 40 people here. None of them are wearing masks. Their kids are playing in the background. The audio is horrible. So I've got 4 little kids. So with kids yelling in the background, you're trying to listen and hear what everyone's saying because you don't necessarily want to be redundant. And after being up here for like 90 seconds, I know how that baby felt, which is probably why they threw up. I'm close, but I'll keep it together for you guys. But my point is, there's more than just what appears to be here when it comes to dissenting views and people that don't want to wear masks. There's 3 levels in this building. There's, like I said, 30 or 40 people on the first floor watching this via live stream. There's another maybe 10 or 15 people on the second floor. We're kind of all waiting our turn to get up here and speak. So for those in the audience that aren't necessarily here, there's more than just me and this guy, and her, and the guy running the camera. There's a lot of us here that think this way. And I've heard a lot of pros and cons to wearing masks since being here tonight. I live here. This is my home. I've lived here for over 10 years. I've got 4 little kids. I like living here. And at the end of the day, I know Mayor Black, we've spoke a few times, but I really don't know anybody else. I assume you're all good people and you want to do what's best for our community because you all live here as well. But I think at times it's important to remind you that this isn't your job. Your job is not to keep me healthy. That's my job. Your job is to protect my rights. If we're going to make that your job, then you got a really bad job. Because then are you gonna mandate how many packs of Oreos people can buy when they go to the grocery store, or how many cans of Coke that they can drink, or like someone mentioned earlier, how many vitamins you have to take, or how many miles that you have to run? All things that have been shown to either improve your immune system or be a detriment to your immune system. How many laps did you get in today, Gene?
2 minutes.
You know what I mean? How many? How about you, Luann? How many miles is that? Because the ordinance is 3 miles. Gene made his, but you didn't make yours. You understand? I'm just making a point, right? So we could go around the room and have those discussions. Whose gym membership's expired because you have to work out in order to boost your immune system. We don't hear about those things because, again, that's not your job. Your job is not to keep me healthy. That's my job. It's my job to help keep my kids healthy. That's not your job. At the end of the day, your job is to help to protect our rights. That's what we're here asking you to do. There's a lot of evidence and a lot of anecdotal evidence and a lot of personal stories about bullying and people with pre-existing conditions and all that stuff. I'm not getting into that.
1 minute.
I'm Joe from Overview Street with 4 kids that doesn't want to have to wear a mask when I go to the Good Life, even if it's just to my table, which seems kind of ridiculous because if I can't catch the virus at my table, why or how can I catch it from the door to my table, right? Seems a little silly to me. I'm not a scientist. I'm not a virologist. I sell buses. That's what I do. But I can read and I can process information and I can make good informed decisions when it comes to my health.
30 seconds.
That's what I'm asking you to do. Let me do that. You do your job. And if you choose not to, and if you choose to enforce the mandate, that's on you. But then it's also on me then for me to try and do your job for you next time you run for election. And then you can then determine what ward I live in based upon who your competition is. Because it'll be me.
Thank
That's
you.
all. Thanks.
Thank you. Do we have anybody else?
Good evening, Mayor Black, City Council. My name's Tony Martucci. I live at 1913 Walnut Creek Drive in Papillion. I wasn't expecting to come and say anything tonight, just listen, but I've got 18-year-old boys that just voted for the first time after I told them if you don't at least vote, you have no right to complain about the things your government does to you. So I'll start with a question. Mayor Black, a couple weeks ago, you laid out a pretty eloquent lesson on why this body doesn't have the authority to enact the very ordinance that you're considering tonight. And I asked the question on Facebook, what changed, in which I was directed to an article in the Omaha World Herald, which is never wrong, about a state senator that cited something that gave his legal opinion that you had the right to do this. Now, I wasn't aware that a senator could give a legally binding opinion. I thought that's why we had judges. But all of that notwithstanding, the thing to consider is, as you guys contemplate and take this vote, are you doing this because you feel it is your job, that you're doing something that will change a behavior or something for the better good? Or are you just doing this because you feel like you have to be able to, or want to be able to stand up and just say, well, at least I did something, right? La Vista did something, Omaha did something, Lincoln did something, right? Last night, Bellevue did something, right? So is this just so you can do something that will change, right? In the last 3 months, I can name one business in Papillion that didn't already make me wear a mask, and that's fine, right? Your house, your rules. Until tonight, you know, I didn't know Gene didn't require wearing a mask. One of my sons works for Gene in his garage, and I'm fine with that, right? I work on base. I've been in the Air Force for over 20 years, you know, where we just listen to instruction, and right now, you know, they've got so many regulations put in place on base that people are kind of scared to walk around outside by themselves without a mask. So I just want you to think about that. I have an idea how this is going to play out in the end. Based on some of the questions I've heard tonight, I don't think it's going to be unanimous, which I appreciate, but I just want to understand, you know, when you submitted that, did you bounce that off of any of the city legal guys as, are my citations correct, right? You cited state law, you stated the state constitution, or was that just something that you put out there? And either way is fine. I'm not criticizing. I'm just curious if that was validated by, you know, people of legal minds who are now saying, well, one state senator thinks it's okay for us to do this. So that's all. I just wanted to, you know, understand. I don't know what enacting this mandate is going to change in the city outside of, there's, like I said, one business that I can, well, two now, that I know aren't strict requiring, right? You can go to Hy-Vee and they highly recommend it, but they're not pushing you. And there's even a kid standing at the door with masks if you want them, but they're not telling you put it on or get out like they would at like a Walmart or Lowe's or somewhere like that. So that's, I just want you guys to consider that, is, do you really think this is going to make a difference when 9 businesses out of 10, you already have to do it anyway, or is it just something so that you're going to feel better?
Thank you.
Thank you.
Anybody
I
else?
have
Oh,
something
Mr. Sunday.
Sir, first to answer your question, from what I can tell, the legal reasoning behind this, and I don't agree with it, but it requires the bastardization of the legal term nuisance, which historically has been applied to activity arising from unreasonable, unwarranted, unlawful use of a person's property that bothers his neighbors, right? That's the common understanding. But they're calling this virus, which isn't a person and isn't property, a nuisance, which bastardizes legal definition going back hundreds and hundreds of years. That's the legal reasoning behind the senator, and I guess that the mayor's now supporting. So what do you think about that?
Well, I didn't know what to think. That's why I asked the question, right? When essentially the chief executive of your city comes out and says, look, I get it. I'm getting inundated with emails and phone calls to the mayor's hotline saying, why aren't we doing this? Why aren't we doing this? Well, let me tell you why I'm not doing it because I don't want to. I'm doing it because I can't. And here is chapter and verse. And now, 2 weeks later, you know, the body that he oversees is now trying to enact this very thing. So I don't really know what to think. I'm not a legal guy, right? I graduated from a state school with a pre-business major.
Thank you. Anybody else? Nobody in chambers? Chief Lyons? Is there anybody out waiting to come up? Zero? Okay, I'll close the public hearing. So the only thing on the agenda tonight was the public hearing. We've closed the public hearing. So nothing else to act upon unless council takes some action. And I'll start the discussion because the Board of Health did recommend a waiver of the third. Obviously, you're not required to follow that, but since they did recommend it, I'm going to throw that out as the next discussion topic. If there is anybody that wants to make a motion to waive, and if there is, a reminder that that's a supermajority. What that would accomplish then is having discussion and a vote tonight as opposed to tomorrow, and we do have a meeting scheduled for tomorrow. Mr. Ingberg.
With an explanation to follow, if I could, Mayor, I'd make a motion to waive the third and final reading.
Is there a second? Second by Councilman Mumgarde. Do we have any proponents or opponents on that? Council discussion.
Mayor, this is Councilman Gaines.
Yes, sir.
So I'm going to oppose waiving the third simply because I want to have an evening to digest all the testimony that we heard today. I think it's fair to the people that came tonight to take some time and just really be able to make a sound decision. So I just wanted to let everyone know that. Thanks.
Thank you. Mr. Ingberg.
The reason I'm choosing to at least have the council have the opportunity to vote on waiving the third and final is because I consider the fact that we've gone through multitudes and multitudes of emails, daily updates from the city staff about phone calls and opinions expressed to City Hall and the staff. We've also listened to almost 8 hours of testimony. There wasn't anything in my mind that we heard tonight that conflicted or I find that was much different than what we heard last night, both from proponents and opponents. So I simply wanted to give the council the opportunity, if they felt that they had enough information and have kept up with the information throughout the process and not waited till tonight. I wanted to have them, give them the opportunity to vote to waive.
Any other discussion? Mr. Sunday.
My thinking is in line with Councilman Gaines, and I'm opposed to that as well. Thank you.
Anybody else? Mr. Glover.
Yeah, Mayor, my question is, I would like you to explain the process if we go forward tonight. If we implement this mask ordinance, then at what point or how do we get the mask mandate taken off? I know that OMA, they set it for a certain amount of time. Can you explain what that would entail and how we would, if things turn drastically downward, how we can get the mask mandate off if we were to pass it tonight?
So I think both when does it start and when does it end would probably do both. So whether we vote tonight or tomorrow, the way it's written is, well, any ordinance, once it's passed, there's a 15-day waiting period. And that's the way it is written. But the Board of Health does also recommend, and there will be a motion to amend at that point. They do recommend an emergency clause, which you have a right to pass. An emergency clause takes a supermajority to pass. No, the motion to amend to add the emergency clause needs a simple majority, but if the emergency clause is added, then it takes a supermajority to pass that ordinance with the emergency clause in effect, if that makes sense. So that'll be tonight or tomorrow. And what the emergency clause would do is waive the 15 days. So pretty much then would become effective immediately. Assuming it passes, the way it's currently written, and the motion that'll be on the floor does have a date certain to end, and it's towards the end of February. However, I do believe there's a council member that is probably prepared to bring a motion forward, and I think you've got a copy of it, that would propose another trigger to end it. So leave the date certain in there, which is the end of February. However, if the governor's color chart, you know the one I'm talking about, where it's the percentage of hospitalization rate, if that falls below a certain level, then go ahead and end it prior to that date certain. That's not in the current ordinance, but there is a council member, I think, that wants to bring that forward. So those will be additional discussions in the future. And then if you have any other ideas, of course, those could be amendments. Did that answer your question?
Yes.
Okay,
yes,
Mr.
thank
Sunday.
you.
I just want to briefly expound on what I said a moment ago. One of the things I think we might need time to consider and maybe even sleep on is I think there's going to be some amendments proposed. One I just heard the mayor mention. I had another one in mind pertaining to the minimum age on this thing. I think some of the testimony we heard, I found compelling, especially with regard, to the children. I'm still going to vote against this measure, but I would like to be looking at that age, because I think 5 years old is somewhat ridiculous. And that's something that this body can change. And I think we all need time to really sleep on this before we start arguing about possible amendments, and then everybody make their final pitches. But I think it's getting late now. I think we're all tired. I think it would be wise that we just adjourn and take this up tomorrow night.
Thank you. Any other discussion? If not, please vote. And again, the vote is a yes is for the waiver, and that takes a supermajority.
Gaines votes no.
Five yeas, 3 nays by Sunday, Gaines, and Stubbe.
Motion fails, so we have a meeting scheduled tomorrow night, same time. The only item on the only agenda item will be the discussion. And so we'll just wrap up. Are there any council comments just in general? Mr. Glover.
Yes, Mayor, I want to publicly acknowledge the work that Tony group and all the work they did on the lights again this year. It's beautiful, and also thank somebody, whoever was in charge of putting the drive-through together to allow the people to drive through and look at the lights. I think as we've talked about this pandemic, there were a lot of people out there that just come out and walked around. There were a lot of people that drove through just because they were tired of sitting at home. And I myself, I knew if I stayed in my car, I wasn't going to be in any danger. So I drove down and back through, and it was enlightening. It was good to see. And we had a banner night with the weather. It's just too bad that we couldn't do like we've done in the past. So, but it was beautiful again. And I know those guys do hours and hours and hours of work, and I want to thank them publicly.
Well, and they were impacted by COVID as well. So he had times where his workforce was short. So they did extra work to get it done for the residents. So really appreciate that. And the Community Foundation is the one that organized some of the drive-through and thought through that as well, and got the businesses downtown and other areas to dress up their windows for the holidays, which I think was a nice extra touch as well. Mr. Stubbe.
Yeah, I'd like to just make a comment with regard to what Mr. Sunday mentioned relative to the amendments. Obviously, I'm proposing an amendment to the ordinance, and I guess I think I'd try to have Amber get it out to the council members early enough so they could take a look at it. But because of the fact that we're meeting again tomorrow, I'd appreciate to get any amendments that's being proposed by Mr. Sunday ahead of time versus having to discuss them at the time of the meeting. So thank you.
And on that, just so we don't violate any open records, if you do have a proposed amendment, I would recommend just sending it to Amber. That way there's not council discussion going around, but then she can keep council informed so you can be thinking about it. So thank you very much. Just for the public who's watching, there is no public comments tomorrow. Today and yesterday was the public comments. So tomorrow will be council discussion and then vote. Mr. Jaworski.
Yeah, I just want to touch base a little bit on the kids wearing masks. I mean, what we're proposing is just when you go into the buildings or when you're close to people, we're not asking anybody to wear these masks. I mean, for me to wear this here for 2.5 hours, this is the longest I wear a mask in a day. I just wear it to go into a building, get out of the building, whatever. But for the kids that are wearing the mask, that's a school thing. That has nothing to do with us. And I don't think what we are asking, if it does pass, it's going to be the same thing. Just wear it when you have to, and it comes off when it has to. So that's all I got to say.
Thank you. Is there a motion to adjourn? Motion by Councilman Glover, second by Councilman Klug. Please vote.
Gaines votes yes.
8 ayes, 0 nays.
We are adjourned. See you tomorrow night.